Welcome to the Gary Null Show, a program designed to enhance mental, physical, and spiritual well-being through science and the wisdom of the ages. Let us take you on a journey of empowerment. Sit back, relax, and get ready to change your life for good.
We're surrounded by so many allergens, and we used to think it was just chickweed or cats or strawberries that caused us to overreact. Now we know that there are thousands of items that can cause our immune system to go into a tailspin. I'm Gary Null. Nice to have you with us today when we explore allergies, a natural approach.
There is an allergy epidemic in the United States, in fact, throughout the Western world.
And what this allergic reaction is your body is reacting to something as if you have been poisoned, literally.
If these conditions and allergies are not taken care of, then later degenerative diseases can take place, which are not reversible.
To give you some glaring examples, asthma, which I consider to be predominantly an allergic disease, is now affecting 13 million Americans. It's increasing at the rate of about 10% per year, and the mortality rate has tripled since 1980.
I started to get shortness of breath and attacks of inability to breathe, which would send me flying over to the emergency unit of the nearest hospital.
Another good example of the allergy epidemic is middle ear disease, otitis media, for example. A lot of people don't think of that as a food allergy-related problem, but clearly it is. 10 million kids each year are affected by middle ear disease, middle ear infection, fluid in the middle ear, and in fact, it's the single most common reason why kids see doctors in the United States.
The hearing specialist recommended that we took him to his pediatrician to see if we can get the fluid cleared up, and the pediatrician put him on antibiotics, said it was really nothing to worry about, that many children had fluid in their ears and it really wouldn't hurt him, and it should go away in a few months.
Eczema, allergic skin condition, often tied into reactions to foods. In 1946, 50 years ago, about 5% of kids could expect to develop eczema in their early life. The last figure that I read in 1990, over 20% of kids can expect to develop eczema. So absolutely, allergies on the increase right across the board.
Earaches, rashes, skin rashes, migraine headaches by the score. And I had no feelings through my body. Everything was very difficult for me to do. Very extreme nervousness, clamminess, desperation, feeling of, I had a lot of vertigo and extreme dizziness.
Allergies was really so bad that sometimes when I'd be with friends, they'd actually kind of shun me because once my nose really started to run, it looked as though like I had some kind of disease or something like that.
Symptoms were rather systemic. They involved weakness, a weight gain, chronic ear infections, in addition to bronchitis, coughs, colds, rhinitis, you name it, I had it.
Allergies are clearly the sign of a weak immune system. A person with a strong immune system is not going to have allergic reactions to the pollen in the air, dust, or chemicals in the environment as a person with a weak immune system will.
We hear so much about an underactive immune system where people get lots of infections, or we hear about it with AIDS, where the immune system is not strong enough to fight infection. Allergy is on the other side of that immune system balance, where you have an overactive or a hyperreactive immune system, where the immune system is actually reacting to things that it normally wouldn't, such as a food that you eat, such as something you take in the air like mites or dust or pollen, or even chemicals.
Allergies are a hyper or excessive reaction of the body to both external components of the environment, dust, pollens, trees, weeds, animal hairs like cats and dogs, and also they can be a reaction to internal components, abnormal organisms in the intestinal tract such as yeast or parasites or viruses even, where the immune system is fighting against these organisms and causing secondary reactions.
If the immune system is functioning well and is not overloaded or overwhelmed, then it basically protects us from our environment. It allows us to properly react to our environment and to handle it without symptoms and without the creation of disease. Unfortunately, for a variety of reasons, the immune system becomes undernourished, which means it doesn't function optimally to protect us from the environment. It may also cause it to misperceive the environment and start treating things that we normally consider as self and friendly as foreign and non-self, and creating all kinds of extremely violent biochemical and physiological reactions in the body, releasing chemicals that we know of such as histamine, and other ones that are even more powerful than histamine with bizarre and dangerous sounding names like leukotrienes and inflammatory prostaglandins. And I basically think that the immune system is just trying to clear the body, to detoxify the body of these foreign substances.
Usually, in most cases, it has to do with an overloaded detoxification pathway, when the immune system becomes burdened with too much insult, either through environmental, chemicals, or pesticides in our foods, or allergic responses themselves create a certain biochemical reaction within our body. The detoxification systems become overburdened, and with that you have a hypersensitivity and an immune response.
I'm often asked what is the similarity or differences between allergic reactions to the environment, such as food, and chemicals. Interestingly enough, in the way they manifest themselves in terms of human suffering and illness, there's not much difference. Chemicals are capable of producing exactly the same conditions, whether we're talking about asthma or attention deficit or inflammatory bowel disease, you go down the line. The symptoms and the conditions are often the same, and as I mentioned before, they often occur together. The only difference may be in how the immune system and the detoxification system of the body handles environmental chemicals or toxins as opposed to food allergens. That may be the only difference, but both of them are clearly tied together, and both of them do create an awful lot of human suffering.
When a foreign substance enters the body, the immune system becomes on duty, or it becomes alert, and protects the body through several different ways. One way is through some specialized cells, T cells that are produced by the thymus, and B cells that are produced by the bone marrow. And these immediately go to try to help the body ward off whatever the foreign invader is, whether it be a microorganism or a harmful food or a chemical. Some people have very simple allergies. They may have just one food allergy, or they may just wheeze and sneeze when ragweed's out, or they may get a headache when they put gasoline in their car. Another group of people will have a combination of allergies. They may have a few food allergies, a few chemical sensitivities, a few inhalant sensitivities. There is another group of people who are said to be environmentally ill, and they will have allergies to all of these things, and quite severely. Many of them have difficulty carrying on with life. For instance, they may have only one or two foods to which they do not react. Any chemical can send them into a terrible reaction, and they will also be allergic to pollens and dandruds. These people are called universal reactors, and they are the ones who are environmentally ill. It can be a mild environmental illness, or it can be so severe that it's life-threatening for these people.
Most allergic reactions people will have is tremendous sinus congestion, blowing their nose all the time. Airborne allergens would be more like sneezing, coughing, choking, wheezing, even going into an asthmatic type situation. So it depends on whether it's inside or outside, but most of it is what we would call a catarrhal condition, or what people know as mucus, where they get a lot of flowing from the watering from the eyes and the congestion in the nose, a lot of mucus running out of the nose, or coughing and spitting up. There might be even down to a yellow-green kind of a mucus that comes out of the head. So it's the body is going through what is known as a vicarious elimination. It is doing its absolute best to throw off this poison faster than the body is reacting to it, so that the body doesn't go into a complete state of shock and later on create major damage in the system.
There are many, many important people in the field of allergy. One of the really giants in the field is a man that we just lost recently, Dr. Theron Randolph, who dates all the way back into the 1930s. And I can remember my first exposure to him about 20 years ago was reading one of his books where he made a statement I thought was much too strong, and he said that food allergy is the most commonly undiagnosed medical condition in the United States today. 20 years later, I'm almost tempted to say that's an understatement. More human suffering is either caused by or aggravated by adverse allergic reactions to foods.
Most common allergy is a food allergy that can be shown anywhere in the body. Physically, you can have arthritis, asthma, headache. Mentally, you can have hyperactive, depression, mania. Emotionally, you can be very irritable, nervousness, anxiety. So food actually can cause all kinds of diseases.
Food allergy expresses itself in many, many different ways. In fact, there's over 200 different allergic symptoms that have been associated with allergic reactions to foods, and over 60 medical conditions that have either been shown to be provoked by allergic reactions to foods or even caused by allergic reactions. And you can start from the top of the head and go down to the bottom of the feet, the different ways that allergy can express itself, from chronic pain conditions like migraine headaches, even muscle aches, joint aches can be provoked or caused by food allergy, digestive problems, skin problems, breathing problems like an asthma, and so forth and so on. The diseases run the gamut from autism to attention deficit hyperactivity disorder to asthma, allergic skin conditions, inflammatory bowel disease, even obesity seems to have a food allergy component, at least in my experience. People eliminate allergic foods, they lose weight. They eat allergic foods, crave allergic foods, they gain weight. So it's actually the great masquerader. It seems to be reflected in many, many different ways in the human body.
Unfortunately, there is a limited benefit from the traditional approach to allergens. There's limiting testing, there is limited treatment. As you will see, it is a much more complex area than what we've been led to believe.
Traditional allergists have a fairly limited view of allergies in the sense that they look at only one type of allergy, and that is allergies that are mediated by a specific type of protein called IgE, or immunoglobulin E. And this classically mediates allergic conditions like asthma, rhinitis, which is nasal congestion, or eczema or hives. But in a more broader view of allergy, we see that it can be mediated by numbers of other immune mechanisms, either other types of immunoglobulins such as IgG, or even certain cellular immune problems. And certainly in the case of chemical sensitivities, which is not a classic IgE allergy, it can be mediated by immune mechanisms, and therefore it would really be thought of as a sensitivity or an allergy, but not in the classical sense.
So I began taking allergy injections for a few years, but the funny thing is I wasn't really getting any better. And when I brought this up to the doctor, he said, well, you know, if you stop taking the injections, all the good that they've been doing will have been for nothing, and you'll be so much worse off. Do you want to take that risk? And I guess I was supposed to say, no. I dread the thought of being worse off than I am. But I really wasn't doing well at all. I was succumbing to attacks of asthma with this, only moderate exertion. I was sneezing all the time. My body aches were pretty bad, and I really wasn't getting any better.
Asthma is often treated with medications without consideration of the allergic underpinning of the wheezing in the chest, which is the target organ of the allergy symptomatology. Migraine headaches being treated with medication and many other methods which don't deal with the underlying allergic condition which is provoking the migraine headache.
The traditional doctors, they put me on Valium, suggested I see a psychiatrist, bed rest, or try to forget about my symptoms, which was very hard to do since I was not well and didn't know how badly the illness was, and it was getting worse day by day. I suffered migraine headaches 3-4 times a day in each eye. I couldn't walk. I sat up all night waiting and praying to die.
Using chemical pharmaceutical medicines interfere with our body's natural ability to repair itself. Every time we take these pharmaceuticals, whether they be for allergies or for infections or for whatever the problem might be, they actually weaken our immune system. And when we do this time after time, over and over again, we find that our immune system becomes very weak. And it takes a lot of work to rebuild this immune system.
Taking injections, and there was no real discussion of food intake and that sort of thing, which really turned out to be the main problem area for me.
I had been to a lot of conventional Western medicine doctors, and when I was a child I went for years and years of allergy shots, and when I turned 18 I just said enough of this, and I cut all that out, and basically I noticed no difference whatsoever. The doctors would talk about things like depression and want to prescribe a lot of psychopharmacological drugs, and I pretty much just didn't do any of that stuff.
Food allergy is a controversial subject primarily because there are people who define it differently. The conventional group, dating all the way back to the 1920s, I think very arbitrarily decided to define it as an allergic reaction involving 1 or 2 foods in the diet that could be picked up with a skin test or a blood test looking for a specific type of antibody, and basically only affected certain systems of the body. If it didn't affect the skin, if it didn't affect the digestive tract, it didn't affect the breathing, it wasn't a true quote-unquote food allergy. Many authorities today are challenging that definition, and the definition has broadened to include a whole group of reactions called delayed onset food allergy, which basically can't be picked up with a skin test, cannot be picked up with a conventional allergy test called the IgE-RAS test, and affects basically any system or tissue of the human body. So you have these two camps, I think both well-intentioned, who disagree and create controversy because they can't agree to what represents the proper definition of the term food allergy.
In conventional medicine, we really look at dealing with symptoms. We do disease care. When symptoms present, we try and get rid of them. You know, in a more natural approach to medicine, we try and understand, why do I experience the symptom that I'm experiencing? I practice what I call integrated medicine, which means that I don't have only one system that I use, that I look at people's whole lives. I look at their diet, I look at their emotional state, their stress level, and their medical story.
The typical allergic reaction that everyone's familiar with is the overt allergic reaction when somebody eats a strawberry and they get a hive, or they have shellfish and they have an asthma reaction. That covers about 25 to 30% of the population that has those kind of overt allergies. They're the kind of allergies that show on skin allergy testing when the doctor will inject into the surface of the skin some portion of that allergen, and there would be a skin reaction. Those allergies are IgE-mediated allergies. They're immediate reactions. People usually know what those allergies are, and they try to avoid it. The more insidious, less obvious allergies are the IgG-mediated allergies, which are the allergies that elicit an immune response. The immune response is an antigen response which compromises the immune system, and the immune system is producing antigens and antibodies to harmless substances like foods, and our armies are going to work for things that aren't that important, like foods.
The patient can test themselves via two basic methods. One is to remove the food for a period of about 10 to 15 days and then to reintroduce the food as a monomeal, or to use the COCA pulse test, whereby the pulse is taken in every morning at a specific time and then is retaken after eating a food.
When we look at allergy, we need to, number one, take a very, very thorough history, listen to the patient, find out exactly what their symptoms are, and that can be a myriad of symptoms, not only limited, again, to classic allergy symptoms like nasal congestion or wheezing or cough or skin rash, but a broader sense of allergy can look at symptoms that would include anything from brain symptoms such as cognitive dysfunction, you can't think clearly, or brain fog, fatigue, muscle or joint aches, all kinds of gastrointestinal problems ranging even from constipation, diarrhea, to bloating or abdominal pains, nerve problems like numbness or tingling or what have you. So there's a really long list of symptoms that can be associated with allergy, and we need to consider these when we see patients. When I see a patient that comes to me with a long list of complaints, have to try to think of ways to tie these together, and allergy is one of the ways we can tie this together.
If you're fine and you eat, touch, or smell something so that there is a change, you have to say, is it due to something inside, outside, a food, or a chemical? And if you want to document or try to prove exactly what's causing the problem or the area, you check your pulse, you check your breathing, you check your writing or your drawing, you check how you look, and you check how you feel. If you do that, you are going to find answers that have been missed for years. You may find out why you need blood pressure pills. And if you can eliminate the cause, your blood pressure may come down without medication. You may find out why you have an irregular heartbeat, why your muscles cramp and go into spasm, why your child wets the bed, why you have a hoarse voice or can't speak clearly, why you have a hearing problem, why you have an activity or a mood problem, why you cry for no reason at all, why you have chronic headaches or depression. I don't want to give the idea that every illness that ever plagued mankind is due to an environmental factor, but I'm saying it's missed repeatedly because we weren't taught about it in medical school.
We now say that there is another type of allergic reaction to foods that affects most people. It's much more common, called delayed onset. And what it means is, as I failed to mention in the immediate reaction, is that when you eat a food that you have an immediate allergy to, you have symptoms very quickly, usually within an hour or two or less, sometimes within seconds. The delayed onset group says that the symptoms appear anywhere from 2 to 72 hours after you consume the food. And it's very interesting that things like epilepsy and migraine headaches and asthma frequently have allergic symptoms that appear the next day after you eat the foods. Not uncommon 48 hours after you consume the foods, and this is in very well-controlled scientific studies. Secondly, it's not 1 or 2 foods, it's anywhere from 3 foods to 5 foods to 10 foods. In the Egger study on epilepsy, for example, he found one kid that could provoke an epileptic seizure to any one of 10 different foods in his diet. Third, you can't pick it up with a skin test. You need to use another testing procedure that I'm familiar with, that I've used for 15 years, called the IgG, not IgE, but IgG ELISA test, that is an excellent screening test to pick up delayed onset food allergy. Interestingly enough, not only is it multiple foods and the symptoms appear 2 hours to 72 hours later, but as you could predict, rarely is it self-diagnosed. And these are the conditions that doctors see frequently, but because they don't view allergy properly, they misdiagnose.
Those are the kind of allergies that are important to try to locate. The only way you can do that is by an elimination diet. And what one needs to do is eliminate a suspicious food. One of the most common ones are wheat for 5 days, and then reintroduce it into the diet with a isolated wheat source early in the morning all by itself, and then a second exposure later on in the afternoon, and then wait within a 24 to 48 hour period to see if there is an allergic response. Once you eliminate the food from your diet for about 5 days, you eliminate the antigens and antibodies, so it becomes more obvious to you whether or not you're reacting to it.
Many people will have more than one allergic condition. So if you add these all together, they sound rather astounding, but there are actually people who have 3 or 4 different conditions simultaneously. Probably one of the most common ones would be migraine headaches. It's been estimated that it does affect about 30 million Americans, of which approximately 5 to 6 million have migraine headaches at least once a month, sometimes 250 times a year. My experience in the scientific literature says that the majority of those people have a food allergy chemical sensitivity problem. Another real common condition is irritable bowel syndrome that we see extremely frequently. In fact, it's the single most common reason why people go to see a gastrointestinal specialist. Approximately 30 to 40 million Americans, most of them women, suffer from this condition. It's associated with abdominal pain or cramping, diarrhea alternating with constipation, and a number of other symptoms.
As you get more and more of a saturation of this waste material around the cells, what happens is the body goes into seeing it as a poison, and it creates an allergic response. The histamine becomes stronger and stronger, and the body does everything it can to throw it off. So you might get hives, you might get boils, you might get discharges from the nose, the watery eyes, the tickling in the throat, all this anxiety feelings. These are all part of allergic responses.
Depending on what the shock organ is, whether it's the lungs, someone will have asthma. If it's the skin, someone will get eczema or hives or swelling. If it's the gastrointestinal tract, someone will get diarrhea or bloating. Will depend on the kind of reaction someone has.
A condition that neurologists call chronic neurological conditions of unknown cause. These are things like loss of feeling and abnormal sensations in the arms and legs called peripheral neuropathy, and balance problems called ataxia. We're now suspecting that a gluten sensitivity, an allergy or sensitivity to gluten found in wheat, rye, barley, and oats may play a real important role. And I should also mention autism. Autism, there's now published literature suggesting that autistic kids, many of those kids, their condition is at least aggravated, if not fundamentally caused by exposure to common food allergens such as dairy products and wheat products.
If the inflammatory process continues, chronic conditions develop such as sinusitis or arthritis. And if these conditions and allergies are not taken care of, then later degenerative diseases can take place which are not reversible.
Well, we can't get it all in one program, so I hope you join me again next week, and we'll continue our saga of Allergies, A Natural Approach. I'm Gary Null. See you next week.